Well, thank you so much, and thank you everyone for joining us tonight. I'm very excited to be talking about skin resurfacing and the new advancements with Aerolase's LightPod Era. So let's get over and started here. I'm just going to make sure I have a laser pointer on here. So just a little bit about myself. So again, my name is Bradley Bloom. I'm a board-certified dermatologist. I completed my residency at NYU in New York, then went on to do a fellowship in procedural dermatology in New York as well. And I served as a former board member for the American Society for Lasers in Medicine and Surgery. And I highly recommend to anyone who's really interested in pursuing lasers in their career, join ASLM. It's a great society, and it's really where you learn the cutting edge technology. And oftentimes on the annual meeting, you'll see actually Aerolase's technology presented pretty frequently. I currently serve as an assistant professor at NYU School of Medicine, and am very fortunate to work at Skin Laser and Surgery Specialists of New York and New Jersey, which is a group dermatology practice, large group dermatology practice, and we'll kind of talk a little bit about how Aerolase is important to our practice. And I've been using the Neo and the Era in our office since 2015, and talk a little bit about my experience as we go along. So there are two methods for skin rejuvenation, or two main methods. The first is the non-ablative approach, where we think about dermal collagenesis. And these are the treatments where we leave the epidermis, the top layer of the skin, perfectly intact, and we're really just heating the papillary dermis, where the collagen is, to stimulate new collagen to form. These are the non-ablative devices. Aerolase has one that's called the Neo, which we have in the office and we use very frequently. And at the very end, we'll talk a little about using that device in combination with the Era, which is going to be the focus of our talk today. And then there's epidermal replenishment. And what we're talking about here is basically removing layers of the surface of the skin and then having our own body replace them with new, more youthful skin. And there are a few ways to do that. The most commonly talked about are the chemical peels, and then there are the newer ablative lasers. And chemical peels have been used for a very, very long time and certainly are effective. Basically, you're using a chemical solution to slough off dead skin, and which eventually peels off to replace it with new skin. However, peels do have some disadvantages. So particularly when we're talking about deep phenol peels, there's a risk of systemic toxicity, there's potentially a risk of scarring. Oftentimes the skin is pretty irritated after a chemical peel, and that can last for quite some time. And the depth of the treatment is relatively imprecise, especially when you compare it to our laser technologies. And it's difficult to control the depth. Additionally, it's hard to really do partial area treatments with these chemical peels, whereas we can do that with the Aerolase Era. When we talk about ablative lasers, we're talking about ablation of the skin, so removal of at least some portion of the skin by vaporization. And so how do we do that? Well, basically, we choose a laser that emits a wavelength of light that is absorbed by water. So water is present through all the levels of the skin and serves as a chromophore or a target for ablation. So as we fire the laser, the water absorbs the laser energy and ablates the tissue so that you vaporize that portion of the skin. There are two main wavelengths of light that we talk about when we're talking about ablative lasers. There's the traditional CO2 10,600 nanometer wavelength. And if you look on this curve here, what you can see is the absorption coefficient is relatively low for the CO2 for water when you compare it to the Erbium YAG, which has the highest absorption for water at this peak at 2940 nanometers. And that provides an advantage that we'll talk about in a little bit, because it has such a high absorption, it means it has very clean ablation, meaning there's less collateral thermal damage, making it a very safe and effective treatment using the Erbium YAG. And so what's the evolution been for ablative lasers? Well, the first ablative lasers really were the CO2 laser. The fully ablative CO2 laser certainly is effective, and effective very quickly, one session, but it can be rather invasive, causing more thermal damage to the tissue, and it certainly has a significant risk of side effects and a prolonged healing time, and that can limit the treatment use. Then there were the long pulse Erbium systems, And these, again, were effective in one session, but were rather uncomfortable, again, had a prolonged healing time, and carried that similar risk of scarring and discoloration similar to the CO2. Then we saw the development of fractional CO2 and erbium lasers. And certainly the recoveries were much quicker than the traditional CO2s and the long pulse erbiums, but still it's an uncomfortable procedure, not quite as effective as those fully ablative lasers. There was bleeding, and also it requires multiple treatments because you're only treating a portion of the skin. It's not going to be quite as effective as the fully ablative lasers. And what Aerolase has done is develop the light pod era to address a lot of these limitations from the other lasers. And what they've tried to do is make a device that's effective in one session, that has minimal bleeding, has minimal downtime, and that's all possible because of the lack of the collateral thermal damage, which you'll see exactly why Aerolase chose certain parameters for their device that allow them to do that. Really what they've done is they've optimized the parameters by really making a short pulse duration, meaning how long the laser actually fires. And by making it very short, they made it 300 microseconds, you can minimize the amount of heat that's spread to the areas that you don't want to treat. They also have optimized a parameter to use a repetition rate at about 1.5 hertz to make it comfortable and, again, minimize the risk of bulk heating. And the beam is collimated. And here you can see a diagram of what the laser does to the skin, the histology of the skin. And if you look all the way on the right, you can see what continuous wave CO2 lasers do. So these traditional continuous wave CO2 lasers would ablate the skin, which you can see, but they also have this area that's in the diagram is shown as a purple area that they're calling residual thermal damage. And basically that's heating of the skin of tissue that's not being ablated. And while there is some advantage to doing that, there's some tightening effect that also prolongs the healing time and also increases the risk of side effects. And so then we saw the development of these shorter pulse CO2 lasers, which had less collateral thermal damage, significantly less, but still had collateral thermal damage. Then we saw the development of these long pulse erbium YAGs. And in that case, we saw a dramatic reduction in the residual thermal damage, but still there was some. And Aerolase has developed a system that uses a very, very short pulse duration at 300 microseconds, which allows for very, very clean ablation. What I mean by clean ablation is that you're ablating tissue with very little collateral damage, which minimizes the risk and also minimizes discomfort of the treatment. So with CO2 lasers, the fully ablative CO2 lasers, bleeding is very common post-treatment. Even when you're talking about full area ablation and fractional area ablation, despite what everyone thinks. And we've seen, and it's been published, well established, that patients who are treated with the erbium YAG recover more quickly from the procedure than those who are treated with the CO2. The risks with the CO2 are long-term hypopigmentation. Certainly there are other risks, but probably the biggest fear that we see is this long-term hypopigmentation. And you can see this sometimes in some of these older patients who received this treatment years ago, who come into the office and they have this kind of porcelain white appearance of their upper lip. But you can see here in the figures, this person had fully ablative under their eyes and certainly had a big complication here of hypopigmentation. And another patient who had hypopigmentation on the chest after a CO2. And so this is the stuff that we're trying to avoid, and that's why Aerolase has chosen specific parameters, and we'll go over that. So this is a great paper that was published in 1999 by Rox Anderson, and it was published in the Archives of Dermatology. And what they did was they compared the erbium YAG laser with the carbon dioxide laser in terms of resurfacing of the skin to treat wrinkles. And what they showed was that the erbium YAG laser is safe and effective in removing facial wrinkles, but also they showed that the erbium YAG patients recovered more quickly than the CO2 treated patients. And that's very important because downtime is a very real issue when we're talking to our patients. And while a lot of patients want to have the best results, they're not really willing to have extended downtime. And that's where the erbium has some advantages. Another thing that we see often is the use of scan systems. So Aerolase chose not to use a scan system, because when you're using scan systems, there is a risk of having overlapping and underlapping areas, which can cause almost like a lattice-like appearance. And so by not using a scan system, they're trying to minimize that risk. So what about fractional lasers? Certainly fractional lasers are very, very popular and certainly have lots of advantages. Certainly you recover more quickly because with fractional lasers, you're only treating a portion of the skin, a small percentage, and leaving untreated normal tissue in between. So that means you can heal more quickly, and certainly there is less risk, but it also decreases the efficacy to some extent compared to the fully ablative devices. So, you know, these systems still have downtime, but you have to have multiple treatments. And so a lot of patients are kind of, you know, stuck deciding between, oh, do I really want to have multiple treatments if I'm still going to have some amount of downtime? And that's why Aerolase has chosen to do a fully ablative system rather than a fractional system. This is just showing you that even with a fractional laser, there can be significant downtime. And you can see here pre-treatment and then immediately post-treatment with a fractional erbium, this patient is going to have significant downtime. And while it's using a fractional system is certainly safer than using a fully ablative system, at least some of the traditional fully ablative systems, there still is real downtime. So what has Aerolase done to make the Era the new resurfacing device, the modern resurfacing device? Well, they've chosen very specific parameters to make it safe and effective. They chose the 2940 erbium wavelength that we talked about because it's the most efficient laser wavelength for absorption by water in the skin, meaning it has the cleanest ablation. They chose a 300 microsecond pulse duration with a collimated beam and a repetition rate of 1.5 to minimize the collateral thermal damage to the tissue around it and also to decrease any pain. And with that minimal collateral thermal damage, you're actually able to avoid treatment demarcation lines that can happen with other devices. And so this has now enabled us to do partial face treatments or just treating specific areas if those are areas that are bothering people, really making it easier and more comfortable treatment. So, you know, as I said, with this new Aerolase Era, there's this new ability to treat partial face treatments. So because there's minimal thermal damage that's left over because there's less heat, because the pulse duration is so short, it makes a very gentle parameters so you can treat just specific areas that bother people. And this is depicted here in this diagram. And so before, with other systems, when you wanted to treat an area, you really had to treat an entire anatomic unit, which is the picture on the right, because if you didn't, you would have these demarcation lines. But because the Aerolase Era has optimized these parameters for us, we're actually able to treat specific functional aesthetic units, so individually, so we don't have to do a full face treatment if a patient's just coming in complaining about wrinkles along the lower eyelid, along the lower cheek, along the crow's feet. We can just target those individual areas as needed. Or if someone just comes in and they're complaining about wrinkles around the mouth, things like that. And the advantage of that is that there's less downtime when you're only treating some of these smaller areas. So there are three main protocols that we talk about with the LightPod Era, and Aerolase calls them the refresh, the reveal, and the renew. The refresh is essentially a superficial laser peel or a micro peel. And the idea is you're trying to refresh the skin. You're getting rid of the very, very top layers of the skin to make a smooth, uniform glow. This is the easiest treatment. Patients really just need topical anesthetic, and you know there's minimal downtime, maybe a little peeling afterwards, and patients really are happy with this treatment. I'd say it's the treatment that I use for pretty much every patient comes in at the end of the summer and they want to have a new fresh glow, get rid of some of their sun damage. This is what I start with. Then there are the patients who have a little bit more moderate sun damage, some moderate wrinkles, and that's when we go to the reveal, which is the mid-epidermal ablation. So we're treating a little bit deeper within the skin, and that's where we're starting to target more sun damage. So some more of the brown spots that we're seeing from sun damage, and some more of the lines that we see from aging. And the idea is to reveal the youthful skin. And then there are patients who come in who really have more extensive sun damage and extensive wrinkles, and that's when we use the renew. This is a gentle resurfacing for the deeper lines, Sometimes we'll use it for acne scars to renew and replenish all or most of the epidermal skin. And you can get some very impressive results. This is the most aggressive of the ERA treatments, and oftentimes I do use nerve blocks to make this a comfortable procedure. But for the refresh, certainly topical anesthetic alone is enough to make the whole procedure very comfortable. And here, let's go through some of the before and afters and see what we can do. So here you can see using the micropeel, so that very superficial treatment protocol where you use a 10-millimeter lens, you do one pass for the whole face at an energy level of 1. The Aerolase really has a very simple system. And you can see after just one treatment, you can see the reduction in the appearance of pore size is reduced. And this is quite an impressive result, this out of Dr. Zhang's group. Here, I'll show you a picture from our office. This is actually our office manager. And you can see before and then after just one treatment, you can see a reduction in the appearance of the pore size along the cheeks. And actually, we'll do a close-up on the next slide where you'll see a reduction in the pore size on the forehead. But also, she just has a better glow, a more even skin tone. And this is after just one treatment. Really easy, minimal downtime. After she went back to work on that Monday, I got a bunch of calls from some of the other doctors in our practice who said, oh, when can I come in to get mine done? So, I mean, it's really easy, looks great, and people are really happy. So here you see a close-up of the forehead here. So the appearance of pore size is reduced. The appearance of some of these brown spots is reduced. Gentle, it's just really nice, light treatment that looks great. Here, a patient from Dr. Gordon, and what you can see, really nice results in treating the mid-epidermal level treatment. So this is a person who has more wrinkles, and more brown spots, and you can see really nice results in removing those brown spots, in removing those superficial wrinkles. Excellent results. Certainly the patient is very, very happy. Here, a more aggressive, this is the most aggressive of the treatments that we talked about, and you can see really impressive results. Here using a 6-millimeter lens, doing about 4 passes over the whole face, again at an energy level of 1, really nice results in improving skin texture, skin quality, getting rid of brown spots. This one does have a little bit more downtime, certainly more downtime than the most superficial of the treatments, but really impressive results. Certainly the patient's very happy. And here you can see a patient who I would consider really severe solar elastosis, a lot of wrinkles, a lot of sun damage, and after 2 treatments, really impressive results in some of these deeper etched lines, which are very, very hard to treat. So here you can see a very similar treatment except in terms of parameters, except there were multiple passes done here. So there was a 6-millimeter lens for the whole face, 5 passes for the whole face, and when it says 5 to 8 passes, what happens is for the deeper etched lines, you do multiple passes. And by doing multiple passes, you're going a little bit deeper in those areas so you can smoothen those lines out more effectively. But really nice results after just 2 treatments. Here's a combination treatment. This patient received a sutured lift, which is becoming very, very popular. So you put these small suspending sutures that actually lift the skin, but at the same time, they also had a laser treatment with the ERA. Again, that full epidermal replenishment laser, so that deepest laser, and really nice results in improving the texture. And I like this as a combination treatment. If you're going to combine it with the sutured lift, you could do it on the same visit. What I would recommend is that you do the sutured lift first and then do the laser, just for sake of for ease for you, because there can be a little bit of swelling after the laser, and therefore you want to make sure you're doing that after you've done the lift already. But really nice results as a combination treatment. Here you can see what the healing process is like. And so what you can see is a patient at baseline before treatment. You can see these marked crow's feet here. And then you can see after that moderately aggressive laser treatment, so a 6-millimeter lens with only about 4 passes, really nice smoothening of the crow's feet. At 3 days post-treatment, just with nothing but Aquaphor afterwards, you can see nice and smooth, bare, just a little bit pink. And then by 5 days, fully re-epithelialized. So really nice results with minimal downtime here. And what's becoming more and more popular is the use of these lasers to minimize the formation of scars after surgery. And so here you can see from Dr. Khatri's group the use of the laser on half of this scar at the time of suturing. So something's excised, it's sutured together, and before you put the surface sutures in, the edges are treated with the ablative laser to even out the edges so that they epithelialize together nice and beautifully. And what you can see is the treated section is flatter and smoother than the non-treated area. But what I use this device very, very frequently for, and it's one of my favorite uses, is for the revision of scars. So this is a patient who came in who had a benign tumor that had to be excised that was very, very large. After excision, everything's sutured together, and actually, sutured together beautifully. He didn't take great care of his wound, and he ended up having some puckering at the edges, partly because of not taking care of it, being over, excess movement. And what I said was, come on in. We saw him. I did 2 treatments with the Era, and what you can see is a beautiful result where barely perceptible scar here. And what I do with this is I contour the scar. And what I mean by that is I'll do 1 or 2 passes over the whole scar to superficially ablate the surface, making it very nice and even so that it can re-epithelialize together smoothly and evenly. But any of these thickened areas that are puckering, I actually will do multiple passes, contouring this to smoothen it out. The idea is that I want it to be a very even plane here so that you can't tell the difference. There's no hills and valleys, very nice and smooth. And that's how you get these beautiful results here. And obviously, we're using this here off the face here very effectively with great results. And I think it's an excellent addition to any practice, especially any surgical practice. Here, with a very, very similar concept to what I just talked about, Dr. Klimova used this to revise a burn scar. And what you can see is there are these thickened areas over here and over here. And what you can do is by using the Aerolase and doing multiple passes and contouring as you need so that thicker areas get more passes and thinner areas get fewer passes, you're able to contour these scars to flatten them and make them much more even so they're much more aesthetically pleasing. And this is after 2 treatments. I mean, this is a dramatic result. Certainly, you could consider doing more in the future and even flattening this a little bit further. And then, you can also use the Aerolase Neo, the non-ablative laser, to then go over this area to help reduce the redness. An excellent combination treatment. Another combination treatment, which is really fantastic, and this picture is from David Friedman. What you can see is a combination of the LightPod Neo, which is a non-ablative laser from Aerolase, with the LightPod Era, which is the one we've been talking about this whole time, the ablative laser. And what you do is you do 3 passes with this non-ablative laser, the Neo, which allows for deep formation of collagen and collagen remodeling. And then at the very end, you do a 4th pass over the whole face, very, very superficially with a 10mm spot size, and resurface the superficial portion of the skin. And what you can see before and after 2 treatments, a really nice reduction in the redness. So all this redness is gone, and some of the brown is all reduced, and improvement in the texture and the quality of the skin. And this is after just 2 treatments, which is really excellent results and really quick results. You certainly can treat off the face. You can treat the neck, the hands, the décolleté to improve textural issues, but also to improve that uneven dyspigmentation that can happen from photo damage over time. When you're doing that, I do recommend that you lower the settings, meaning that you're using a lower fluence and really being extra cautious, but certainly can be done very, very safely. Just has to be done conservatively. And that's because healing tends to be slower off the face. So you really want to be a little bit more superficial. But certainly we do off-the-face scar revision treatment all the time, and it's a great application for the Era. So what are the common LightPod Era treatments that we do in our office? I think the most common one are the laser micropeels, the superficial peels, because there's pretty much no one who doesn't need a little repair from the photo damage that they get at the end of the summer. And so I tell people to come in once a year and get a treatment, really easy, or if someone's kind of planning having an event and they want to really make sure that their skin is glowing as best as they can, it's a great treatment. Just make sure you have give them a little bit of time before they go for the event. But certainly we do the deeper resurfacing for our patients who come in with severe solar elastosis, that really severe sun damage. And I think also, scar revision is a big opportunity for us in the office. I have a lot of patients who come in who have seen other doctors or have had a surgery elsewhere, and they want to come in, and they come in and they say, what can I do about the scar? I'm so unhappy about a scar. And this is a great option and a great tool for us to treat those, and that's a person that now becomes a patient of yours. It's a great opportunity, and patients really appreciate it. So in summary about the LightPod era and why I think it's great and why it's been so important for our office, so this is a new 300 microsecond technology, which means that it allows you to have minimal downtime with the same great results that we would expect. There's less discomfort, and really just having to use a topical anesthetic at least for our superficial procedures. It really minimizes the issues that we've seen with some of the other CO2 and long pulse Erbium systems, avoids those demarcation lines, really minimizes the risk of hypopigmentation, and really these patients heal very, very quickly. We are able to do partial face treatments, which is really, really nice. If someone comes in with just one little isolated area that's bothering them, we can now treat them, whereas we really couldn't do that before. But this is just a really versatile device. From doing these very superficial peels, which really any patient can get. Any patient skin types, 1 to 3 easily, very safely you can do. You can do even more gentle treatments if you want to talk about that. We can certainly talk about that another time. But you can also do these very, very aggressive treatments, going deep, treating very deep etched lines, treating scars, and recontouring areas. Really excellent device. Something that we haven't talked about is how compact the device is. The device fits into a suitcase. It is incredibly small, and that's really important for our office, because our office is in New York City, and real estate is a premium here, so every inch counts. So the footprint of a device is very, very important, and this certainly, I can't imagine a laser being smaller than this. So incredibly portable, so if you have multiple offices, certainly you could move it from one office to another, and a very low maintenance laser with minimal to no consumables here. So a great device, we use it all the time. And I think that brings us to our Q&A. So if we have any questions, be happy to take any questions.
All right, thanks, Dr. Bloom. And as you just said, if you do have some questions, please type them in for us, and we'll try to address them. We do have a number of questions to start out with. And one I want to start with, so you already spoke about skin resurfacing and scar revision. Are there any other treatments that you can address or indications that you can address with the ERA?
So, yeah, certainly, yeah. So there are a number of different other treatments that you can do. So for example, people who come in who have epidermal growths, for example, like seborrheic keratoses, those stuck-on kind of tan-colored lesions that can happen on the skin, you can treat those very, very easily with this. You can treat, there are people who will use this to treat warts. I don't do that in my office, but certainly certainly you could do that. Any epidermal lesion, meaning on the surface of the skin, you can target. Even sebaceous hyperplasia has been targeted with these devices, treated very, very easily.
And there's no special settings for that. That's similar to the resurfacing.
Yeah, very similar to resurfacing settings. And that's the beauty of this device, is the simplicity of it. Very easy to use and user friendly. Also, Aerolase provides you with an entire booklet of different treatment protocols for different indications. So, what we talked about really were more the aesthetic indications and these cosmetic indications, but we really didn't talk about those epidermal lesions. But the way you target the epidermal lesions is very much similar to how I talked about treating the scar recontouring. And basically, you choose your energy mode based on the protocol that we talked about, and you decide the number of passes you're going to do based on the depth of the lesion. So thicker lesions, you're going to have to do more passes, and thinner lesions, you're going to have to do fewer passes.
All right, excellent. And so you also went over refresh, reveal, renew. There's a question about how long the results last for.
You know, that's always it's always an interesting question that you know, I get from my patients also. And what I tell patients are the results that you have are long lasting, right? So the benefits you get, you know, any new collagen that's formed, that's your new collagen. However, while we reset the clock, we're not stopping the clock. So people still continue to age. And so typically I tell people when they're talking about doing that micro peel, you know, once a year is typically enough to keep people happy. I do have people who come in quarterly to get it done, people who really don't want to do the more aggressive laser procedure, but still want to maintain that glow. And so it just depends on the degree of sun damage the patient has. So, you know, I think it's relatively long-lasting benefits here.
Yeah, no, and that's a good point. I mean, it is a maintenance program, and so you do have your patients coming back for more and more treatments, and obviously that helps you bolster revenues and keeps your patients happy.
And even our patients who come in for the most aggressive of the laser procedures, I tell them, you know, we should maintain this with doing maybe an annual micropeel to maintain your results.
There you go, exactly. Okay, here's a good question about scar revision. How soon would you like to address the scar after either surgery or the traumatic event?
Yeah, so it's a great question, and I think, you know, it's talked about a lot, and I think it depends on the type of scar that we're talking about. So if we're talking about a surgical scar, what I do depends a little bit on the patient history. So if the patient has a really strong history of having hypertrophic scars or thickened scars, I'm more aggressive about treating them. So oftentimes I'll actually start lasering at the time of suture removal. And really following them very closely. Sometimes I'll include the addition of maybe doing intralesional injections of a steroid to make sure that we're really optimizing our results. But I think you can safely start on a surgical scar, certainly a cutaneous surgical scar, you know, from Mohs surgery or an excision or you know a skin excision, you know, within 4 weeks of the procedure. However, when we're talking about burn scars, that's a very, very different scenario. And what I really want to make sure is that the skin has fully epithelialized from the burn before we start doing any additional damage.
All right, excellent. And just to expand a little bit more on that, we did have a study that was published as Dr. Bloom already had mentioned at ASLMS on scar revision, and it was found that the newer the scar, the better results you're going to get, which isn't to say that you won't get great results with older scars, but the fresher, the better. And as you just explained with the surgery scars and the suture.
Yeah, and I think that makes physiologic sense because we're probably changing the trajectory of the wound healing. We're affecting the way the wound is actually healing because collagen remodeling continues to occur throughout the wound healing process, even months out.
Okay, so it takes good care of another question on the wound healing, and so there's a question on off the face as well on crepe skin.
I'm sorry, what was that?
There's a question about will this machine work on crepe skin on the chest?
So yeah, so crepey skin. You know, so this is a great indication for that. So again, you have to make sure that you're conservative with your settings, but certainly it will improve the crepiness of skin. You probably have to do a little bit more than the micro peel settings, but again, conservative because it'll be off the face. But yeah, absolutely, it can address that. So I typically tell people it's going to for the chest it'll be multiple treatments because anything off the face is going to take longer to heal, and so we do more conservative settings, and typically I'll do multiple treatment sessions. But patients usually are very, very happy afterwards because they get a benefit of really improving the dyschromia, that discoloration that goes along with crepey skin on the chest.
Okay, here's a question that comes up all the time. We have someone that's wondering if this can be used on skin of color.
So Aerolase makes a number, you know, certainly makes the LightPod Neo which is that non-ablative laser that we talked about, and that certainly can be used on any skin type. The Aerolase Era, I would say for the ablative treatments, really you want to be thinking about skin types 1 to 3 for the treatment settings that we talked about here. However, there is another treatment which we didn't really discuss about that Aerolase calls the sublative treatment, and that you can start to use on darker skin types. In that case, the skin's actually not truly being ablated, so you use a similar handpiece that you would use for the micropeel, except you hold it further away from the skin so you're not getting true ablation, and that you can use on darker skin types. However, I would not be using, even that I don't love to use for skin type 6. If you're talking about skin type 4 and want to do a sublative treatment, that's fine. But I really would, unless you really have a lot of experience, I would shy away from doing darker skin types. So 1 to 3 you can certainly do very safely. There are some 4s that you can do, but really, after that you really need to start thinking about the sublative treatment, or really expert. You really have to be doing this a long time. There are some treatment protocols that can work, but I would shy away from it.
All right. So a couple of other questions here. How does this treatment compare to with the results and the downtime of like Fractional?
Well, so so everyone asks the question, Fractional. Well, so Fractional is a brand name, and Fractional has, most patients aren't very confused about what that even means. So there are multiple wavelengths of light within the Fractional family of devices. So there's one that's a CO2, one that's a non-ablative, one that's a superficially ablative. So it's hard to say. Do they want to clarify what they mean by Fractional?
Let's see. They're repair.
Okay. So the downtime is certainly going to be less than the repair. I think the repair is a much more uncomfortable treatment, but I would say you need to. There's more downtime with that device. It's a more uncomfortable treatment. Although I think you get a little bit more skin tightening, I think it's a little bit more risky of a procedure than doing than using the Era. So I think you can, both systems have their advantages and disadvantages. I think you're safer, especially if you're starting or you want to be extra cautious. You're safer with the Era than you are doing one of the CO2 devices.
Okay. And then what about topical numbing or nerve block? Have you needed to use that on patients? So for all the micropeel patients I have them do topical numbing, and typically that's more than sufficient to keep them comfortable during the entire procedure. If they're maybe a little bit extra uncomfortable, we have a Zimmer chiller in the office which I'll use, and I'll let them hold, and they can just put it in the areas where they're feeling a little bit warm. But typically, topical anesthetic is more than enough for the micropeel. As you start doing more and more aggressive treatments, so for example, doing the most aggressive, fully ablative, deeper ablative procedures, I do nerve blocks, and partly it depends on the patient, and partly it depends on how aggressive you're going to be with the laser. So if you're doing 8 passes over an area, particularly around the mouth, I'll end up doing a topical anesthetic for the whole face, and then maybe do some nerve blocks just for around the mouth, which is certainly very easy, and patients really tolerate it nicely. When I do scar revision, I often will do injections, so just simple local anesthesia into the area of the scar. Partly from a timing perspective, it just makes things a little bit easy because they don't have to sit around with a topical anesthetic on the whole time. But I think that if you're going to do very aggressive resurfacing of a scar, I probably would just do local anesthesia. It just makes it easier for everyone, I think. Okay.
But half an hour of something like BLT is typically more than enough.
Okay, perfect. Now, when you do have a patient come in, what do you discuss during the actual consultation? Is this sort of treatment something that a patient brings up, or is it something that gets offered to them?
So the micropeel actually is something I offer to most patients, particularly when as the fall comes and everyone's kind of trying to get rid of that sun damage that they have from the summer. It's something that we have pamphlets in all of the rooms and certainly in the waiting room showing what the results, the before and afters can be. For patients for scar revision, typically those patients are coming in asking about their scars and they're bothered by their scars. Or if a patient is getting an exam for something else and I notice a rather thickened hypertrophic scar that I think is amenable to treatment, I'll mention that, there are ways that we can improve it if it's something that bothers them. For the more aggressive laser treatments, those are typically patients who are interested in some type of cosmetic procedure, and then that's part of a discussion I have as a kind of multimodality approach to just aging in general and treating treating photo damage over the whole face.
Okay. And with that said, I mean, these procedures aren't exactly cheap by any standards. Now, do you find patients are willing to pay for them? Do they kind of hem and haw about it? I mean, how do you get? Well,
so I think it depends. So it depends on a few things. So it depends on what the patient's coming in for. So if the patient's coming in for a cosmetic, like if you're in an office that's a primarily medical dermatology office or a primarily medical office, and you're trying to convert those patients into cosmetic patients, I think that you have to price the procedure accordingly. However, if people are coming in for a cosmetic consult and they want to talk about options, they're typically willing to pay when they see what the kind of results they can get. Obviously things are priced accordingly. Certainly doing the micropeel is not the same price as doing one of the more aggressive lasers for a full face. The micropeel is a very easy procedure to do. It's one pass over the entire face, pretty quick. And when people see the results they can get there, I haven't had too many people say, "Oh my gosh, it's outrageously priced." Especially given that there's very minimal consumable with the Aerolase's product.
And so during the consultation, you'll use photos to help as a selling tool.
Oh, absolutely. I think photos are so critical. So, especially if you're first starting to use lasers in your office, it's so important to make sure you have before and afters of all your patients. And when you're getting started, you want to make sure you have your own before and afters. But one thing that Aerolase does that's really great is provide excellent before and after photos. They provide before and after booklets. That can be really helpful in explaining to patients what it is that you're going to achieve for them, so that they understand why it is they'd be willing to pay for something. And I think when they see those kinds of results, I think it's a much easier conversation.
Okay. All right, so we have a little more time for questions. Again, if you have any more, please let us know. I do have one question here about acne, options for acne, and I believe what they're referring to is acne scarring.
So acne scarring. So, there's lots of different types of acne scars. The scars are classified based on the morphology of the scar. So there are ice pick scars that look almost like well-dilated pores. And then there are these rolling boxcar scars that people see. For the rolling scars or the boxcar scars, which are a little bit more common, what I'll do with that is I'll actually use I'll use the LightPod Era, and I will go over the edges. And basically, what I'm trying to do here is contour those edges so that you don't see as much of a cliff drop, so that there's a very smooth transition from any hills and valleys. And when you don't see those large transitions, when you smoothen those out, so you ablate those edges a little bit more effectively, those scars become less apparent, and certainly you can make significant improvement. Oftentimes, I'll do that, and then maybe I may combine it with doing some filler, or even sometimes something called subcision, releasing any scar tissue underneath. So it's a nice combination treatment.
All right, excellent. And I think you brought up another good point in terms of combination treatments. Aside from acne scars, is there anything that you would use in conjunction with the Era to address?
You know, I really like using so I use the Aerolase Neo in the office also. I really do like to treat kind of some redness and some blood vessels at the same time. Those are really immediate results, and you can use the Neo to do that, and then combine that with the Era right afterwards to have some really nice results and have some really immediate benefit for the patient. I also think that combining those two is a great option for doing treatments for photo damage on the chest, because it gets a little bit more we can treat some of that redness better with the Neo, and then do some of that superficial texture with the Era really nicely. But we often will combine the Era with a lot of our treatments. For example, even doing some of our neurotoxins around the eye and the forehead. So, you know, you can soften those muscles' ability to contract, which decreases the crow's feet, and then also treat them at the same time. It's really nice results.
Okay, excellent. Okay, so with that, I think we will close it in respect to time. Dr. Bloom, thank you very much for an excellent presentation, very well-rounded, and I really do appreciate your expertise on this. And we'd just like to thank everyone for joining us. And again, if we did not get to your question, we will respond to you tomorrow in the next coming days. So thank you very much again, Dr. Bloom.
My pleasure. Thank you. Thank you very much.